Natural Cycles is the only certified and clinically proven medical app for contraception. It uses a sophisticated algorithm to analyze a woman's cycle and accurately predict her fertile days. This video will provide you with the most important information about the Natural Cycles app. You'll find out about what a patient needs to get started, the 3 most important steps to use the app, things you might want to address during your consultation. Getting started. Your patient needs 2 things to start using Natural Cycles: a basal thermometer and the Natural Cycles app. If your patient chooses the Natural Cycles annual subscription, then the thermometer is included. In the case that your patient wants to buy a thermometer herself, please remind her that the thermometer should be a basal one that shows 2 decimals. Her daily routine will involve these 3 important steps: measuring her temperature, adding into the app, and checking the status for the day. She must check her status every day as predictions can change. Step 1. Measuring. You should inform your patient that measuring is the first thing she should do in the morning, before moving around, sitting up, or leaving the bed. When measuring, she should place the thermometer in the mouth and under her tongue, as far back as possible. Once the thermometer is in place, she should press the on button. She should try to keep still when measuring, close her mouth and breathe through her nose until the thermometer beeps. This takes approximately 30 seconds. Patients are encouraged to measure at least 5 times per week. However, the more often, the better. If your patient forgets to measure, this does not change the effectiveness of the app, but could result in having more red days. Please advise your patient not to measure in the following situations: when she's sick, if she's had alcohol the night before and feels hungover, if she wakes up more than 2 hours later or earlier than usual. She also shouldn't have snoozed or been out of bed. In such situations, taking her temperature should be skipped or marked in the app as deviating. This way, the measurement will not be used in the algorithm's calculations. Step 2. Adding data into the app. Once she has her temperature reading, she can enter the data into the app. The view to add data will automatically open up, or she can press the plus icon in the top hand right corner. The patient can also add additional data, such as her period or LH test results. Step 3. Checking the status for the day. Once she saves today's data, the app will calculate her status for the day. It will either be a red day or a green day, indicating whether she needs to use protection to prevent a pregnancy. Green means that she's not fertile. Red means that she's very likely to be fertile and at risk of becoming pregnant. She should use protection or abstain in order to prevent a pregnancy. A patient could expect more red days in the beginning, as the app will take 1 to 3 months to get to know her cycle. Women with fairly regular cycles, who enter temperature data 5 times or more per week, can expect to reach around 60% green days per cycle after 3 months of usage. When your patient has red days, please inform her that she should use protection or abstain, as there is a risk of pregnancy. Using condoms on red days is highly recommended because of efficacy rates and ease of use. Withdrawal is not recommended.